So urinary tract infections are not a very common thing in pediatrics, but when we do see them, we see them more often in our female patients than we do in our male patients. And they're hard to diagnose because they don't have traditional symptoms that we do with our older adult women who get the classic, urinary frequency and burning and urgency and all that. We don't often see that in kids. And so with our young kids, sometimes we'll just get fevers that we can't find any source for, or sometimes we'll have some foul-smelling urine, but when you've got kids that are in diapers, then you don't even know often about accidents and that kind of thing. When they get a little older, sometimes we'll have some enuresis and those things, but they are hard to diagnose, so you have to really think of them very hard. You have to put it in the back of your mind always, okay, is there something else that could be going on with this fever? The reason that we tend to see them more often in our girls than our boys is that the urethra is short and it sits much closer to the rectum, and so most often the bacteria that we get that grow in these, most often it's E. coli, and so they come from the gut. And so especially for our kids who are just being potty trained, hygiene can be an issue. They can often be, pulling that bacteria from the rectum up near their urethra. That urethra sits so close, it's so short in girls that it goes right up in there, and we have problems with urinary tract infections. We also can see with our toddlers that are being potty trained that they are dysfunctional voiders, so they don't often empty their bladder as effectively as they should, and when they do that, then they tend to have urine that stays in the bladder when they don't empty it all the way. That is bacteria multiply. We almost never see urinary tract infections in boys. The only time we may see urinary tract infections in boys would be really young boys who may have some anatomical abnormalities with their urinary tract. So I have done, I don't know how many urine cultures on boys, and I think in my lifespan here I've had one that has been positive. So they're almost exclusively in girls.
Do any kind of workup?
So once we find that the kids do have a urinary tract infection, if they are under the age of 4, there is a recommendation that you would do a workup on them. So the one's easy, ultrasound of the kidneys and the bladder just to make sure you don't have any anatomical abnormalities there. And most of the time that is normal. The other one's a little bit tougher test because it's a VCUG, so it involves, the catheter and the dye, and most parents are a little more reluctant to do that test. But in all honesty, that's the test that most often is going to show us some abnormalities, because reflux is the most common thing that we see. So a lot of kids have urinary reflux, and it can be different grades, just a little bit up grade 1 all the way up into the kidneys, causing some dilation of the kidneys, which is grade 4.
Difference in frequency between males and females with reflux?
Yeah, it's absolutely more common. I don't know what the percentage is, but it's absolutely more common in girls than boys. And it's also hereditary. So if you have a family member that has reflux, there's actually a recommendation that you look at those kids too. But it's way more common. I don't even know. I have one boy that I can think of that's had reflux, and I've met many, many, many girls that have had reflux.